Tauroursodeoxycholic acid, also known as TUDCA, is a hydrophilic bile acid that has garnered attention for its potential therapeutic applications across various diseases. In this video, we will delve into TUDCA's historical background, origin, physiological effects, toxicity profile, effective dosages, and summarize findings from relevant human clinical trials. TUDCA is the taurine-conjugated form of ursodeoxycholic acid, a secondary bile acid produced in the human liver. While present in trace amounts in humans, TUDCA is found in higher concentrations in bear bile, which has been utilized in traditional Chinese medicine for centuries to treat various ailments. The compound was first chemically synthesized in Japan in 1954, paving the way for its use in modern pharmacology. TUDCA has demonstrated hepatoprotective properties, particularly in conditions like cholestasis and chronic hepatitis. Clinical studies have shown that TUDCA can improve liver function by reducing serum liver enzymes such as AST, ALT, and ALP. In preclinical models, TUDCA exhibits neuroprotective effects by inhibiting apoptosis, reducing oxidative stress, and alleviating endoplasmic reticulum stress. These properties suggest potential benefits in neurodegenerative diseases like Alzheimer's, Parkinson's, and Huntington's diseases. TUDCA has also been associated with improved insulin sensitivity and lipid profiles. In a randomized controlled trial involving obese individuals with insulin resistance, TUDCA treatment resulted in a 30% increase in insulin sensitivity in the liver and muscle. TUDCA is generally considered safe and well tolerated. In vitro studies indicate that TUDCA is non-cytotoxic at concentrations up to 400 micromoles per liter over 24 hours. At higher concentrations, such as 800 micromoles per liter, a slight increase in AST release was observed, but TUDCA was still less toxic compared to other bile acids like deoxycholic acid. In clinical settings, the most commonly reported side effect is mild gastrointestinal discomfort, including diarrhea. These effects are typically dose-dependent and resolve upon discontinuation or dose reduction. Clinical studies have utilized TUDCA dosages ranging from 500 milligrams to 1,500 milligrams per day. For instance, in patients with primary biliary cholangitis, doses within this range have been effective in improving liver function. In a study involving obese individuals with insulin resistance, a dosage of 1,750 milligrams per day for 4 weeks significantly improved insulin sensitivity. TUDCA has a high safety margin, with toxic effects observed only at significantly higher doses than those used therapeutically. In vitro studies showed minimal toxicity at concentrations up to 800 micromoles per liter. However, some individuals may experience gastrointestinal side effects at higher doses, above 1,500 milligrams per day, which typically resolve upon dose adjustment. A Phase 2b randomized controlled trial in Italy assessed the efficacy of TUDCA, 1 gram twice daily, in ALS patients. The study reported that TUDCA was well tolerated and showed a higher proportion of responders compared to placebo, suggesting a potential slowing of disease progression. However, a subsequent larger Phase 3 trial involving 336 participants across multiple European centers failed to demonstrate a significant difference between TUDCA and placebo in slowing ALS progression. Despite the lack of efficacy, TUDCA was well tolerated with predominantly mild gastrointestinal adverse events. Multiple randomized controlled trials have shown that TUDCA improves liver function in patients with liver cirrhosis, HCV-related chronic hepatitis, and cholestasis. These studies reported significant reductions in serum liver enzymes, indicating reduced liver inflammation. In a randomized controlled trial involving obese individuals with insulin resistance, TUDCA treatment, 1,750 milligrams per day for 4 weeks, resulted in a 30% increase in insulin sensitivity in the liver and muscle. TUDCA is a naturally occurring bile acid with a history rooted in traditional medicine and a growing body of scientific research supporting its therapeutic potential. Its hepatoprotective, neuroprotective, and metabolic benefits, coupled with a favorable safety profile, make it a promising candidate for further clinical investigation. While results from human trials are mixed, particularly in neurodegenerative diseases like ALS, ongoing research continues to explore its efficacy across various conditions. Credits script based on research articles and clinical trial summaries.